morning, everybody. This is Shelly-Ann Weeks, and we are about to get into Everyday Period. Everyday Period, as you know, is an opportunity for us to have frank, open conversations about female reproductive health, periods, and everything that comes with it. And of course, as I mentioned before, we are in fact going through a global pandemic. What we have been experiencing, and feel free to share your stories here with our special guest, Dr. Samantha Johnson. So, hi Sam. Good morning to you.
Oh,
How you do?
I'm good.
I don't know, that light in your background is shining in all of our faces. So put that light in front of us instead of the hand.
All right, give me a second.
So while Samantha sorts out her lighting, just to give you an idea what we're looking at today, of course, anybody who's in Jamaica realizes that our control, and I do control like this over the pandemic, seems to be slipping through our fingers. And so there have been reports of a lot more positive numbers for persons infected with virus, as well as the fact that our hospitals are becoming filled with different victims that are being tested positive. And it's just more going on because community spread is happening. There's a lot of noise being made about persons who are not observing the protocols. People were throwing parties and things. And of course, add to that, we are smack dab in the middle of election campaigning because, you know, there's a general election going on as well. So there's a whole lot of things in the pot that will definitely make it difficult for us to control a pandemic. So we have to keep the air cold because I find it very interesting the choices that are being made at this particular, especially since so much effort gets into controlling the spread. But before we get into the period side of the conversation, I thought I wanted to pick Samantha's brain as to her thoughts on, you know, just how we've been handling the pandemic overall from a medical standpoint. What do you see going on around you at work in terms of your colleagues and stuff? You know, what's the conversation around what the next steps are in terms of trying to control this? Are you talking about a possible lockdown again? But just give me your take overall on how good Jamaica has been doing, and where do you think we are now, and what are some of the things that you would suggest from your point of view that we adjust?
Okay. Well, in regards to how we're managing the pandemic, I can only give my view. I'm not an expert, I'm not an epidemiologist.
No, man, we don't want to.
So I'm currently work in accidents and emergency. So on our standpoint, most hospitals, or all of them rather, is just all of the hospitals have, as soon as we had the announcement, we started to make changes so that we could keep staff safe and ensure that we also can keep patients safe as well. So from that standpoint, I see that we've been doing the best that we can, all that we can, to ensure that both staff and patients are safe. And then we have a lot of information going around. I think the biggest thing is that we as a population, we have to do our part as well, because there's only so much that both the government and healthcare professionals and hospitals and all different administrations can do. And the onus is really on us to socially distance, to wear masks, to follow the guidelines that are out there, and perform proper hand washing all the time, because those little small activities can really play a huge role in bringing down the numbers and bringing down how many persons are infected. And we have to also consider that I like when people talk about saying just act as though you are infected and the other person is, because then it reminds us even more to stay far away from each other and to put on our masks. And we have to protect the most vulnerable. So our children, the elderly, those who have diabetes and sugar and pressure basically, and other comorbidities, because they're even so much more at risk if they get the illness as well. So we all have to play our part, because it's gonna take all of us to really bring down the numbers and take control of the pandemic.
All right, so it sounds to me like from where you are, the hospitals are getting their stuff together. But this morning I was listening to a report that
Mm-hmm.
something like, I don't remember the actual number, but it was a few doctors who had to be placed into quarantine because somebody was infected. Do you know anything about that?
Well, I'm not aware of that article. But yes, more and more healthcare workers are testing positive, but as well, more and more persons are testing positive. And healthcare workers are people just like you and me.
Right,
So
right,
we might be exposed at work, we might be exposed elsewhere. And then again, that's why it's so important I always advocate for healthcare workers to ensure that they're always wearing the appropriate protective equipment. So always wearing masks and protecting themselves, because the truth is a patient might come in for a broken foot, or they might come in because they're having a urinary tract infection, or even they're having something, just anything, and you never know, because more and more persons
right,
are having the virus and having it being asymptomatic. And I
right.
don't think we're at the point where we're testing persons who don't have symptoms. I'm not
Okay.
100% sure about that part.
All right, so give me an idea what happens on the ground in you say in accident and emergency. So somebody comes in with a broken arm and they're not symptomatic. Are they tested at all for COVID, or they're just treated for the broken
Um,
arm and
Currently, no, but I think, don't quote me on this. I think that we are now testing admissions, or they want all admissions to the hospital to be tested. I'm not
okay.
100% sure. But what happens is, again, when patients come in, they're triaged, so they're asked screening questions, and it's so important that you're truthful, even if you think it's just a little sniffles, even if you think it's just your
Right.
sinus acting up. Just you're not, it's better to just be overcautious than to hold that information to yourself, because it helps us to know whether we're going to put you, we can put you with the general public, or we're going to have to take
Okay.
special precautions. And each hospital has their different setup. So what happens is, if your screening test is negative, you are allowed to come with the general population, but you must have on your mask. Either the patient or whoever is with the patient, everybody must have on their mask. And then the healthcare workers themselves, everyone is in a mask. Some will be in face shields, and most are in gowns as well. So usually it's a face shield, a mask, and a gown
Mm-hmm.
when treating and seeing patients. And we, of course, practice our hand hygiene. And when we're
Right.
talking to the patients, yes, we will have to ask you to maybe speak up a little bit, because it can be
Because of the
difficult to
mask.
hear with the mask, but you still have to keep a little bit of a distance away from us. And even when we're examining, we still have to be very cautious,